Want to catch the risk of prediabetes early, before it silently develops into type 2 diabetes? Don't just wait around until you're constantly thirsty or your blood sugar is visibly spiking. Pay attention to the little signs. If you're constantly dealing with a food coma, post-meal crash, after eating, getting quick sugar cravings, or noticing your waistline expanding even though the scale hasn't really budged, don't just brush it off as getting older. The scary part is that a lot of folks think prediabetes isn't dangerous simply because they aren't on meds yet. The real concern isn't just one post-lunch slump or one single day of blurry vision. It's when these small signs stack up and repeat over a few weeks, especially for those over 60. If your blood sugar stays higher than normal for a prolonged period without being monitored, your risk of developing type 2 diabetes and having a stroke can seriously go up. In this video, I'm going to help you spot those commonly overlooked signs of prediabetes, particularly if you're in your 60s or beyond. You'll understand exactly why your body might feel more wiped out, why you get hungry faster, experience blurry vision, or gain inches around your waist even if your diet hasn't changed. More importantly, you'll know when it's time to check your blood sugar, when to have a chat with your doctor, and what simple daily habits can help you manage your blood sugar more safely. Disclaimer: this content is for informational purposes only. In reality, a lot of people over 60 find themselves in a very similar boat. They're eating their usual breakfast, having their morning joe, coffee, taking a walk around the neighborhood, and doing some light chores around the house. But over the last few months, they've started feeling more exhausted after meals, hitting that afternoon wall, getting occasional blurry vision, and noticing their pants are getting a little snug around the middle. They think, well, it's just a normal part of aging. But when they go in for their annual physical, their blood sugar levels come back higher than normal. What you need to understand is that prediabetes doesn't just happen overnight, and you can't definitively diagnose it just by how your body feels. When you eat, carbs and sugars are broken down into glucose for energy. Insulin acts as the key to let that glucose from your bloodstream into your cells. However, due to aging, a sedentary lifestyle, gaining belly fat, or regularly eating highly processed foods and sugary drinks like cookies, instant ramen, potato chips, soda, sweetened lattes, or bottled fruit juices, your cells can become less responsive to insulin. When that happens, the sugar ends up hanging around in your blood for much longer. That's exactly why some people might feel a crash after eating, get hungry again quickly, experience bouts of blurry vision, or see their waistline gradually expand. While these signs aren't enough to diagnose yourself, they are definitely a solid reason to get your blood sugar checked. But here's the kicker that most people miss. The signs of prediabetes aren't just about intense thirst or a number on a glucose meter. Sometimes, the clearest clues show up right after you eat, while you sleep, or in that feeling of getting hungry again way too fast. So, without further ado, let's dive right into the other warning signs you need to look out for. Fatigue and sleepiness. After meals. Story CTA. Picture a very familiar morning scenario. Someone in their 60s is sitting at the breakfast table. In front of them is a muffin, 2 slices of toast with jelly, a sweetened fruit on the bottom yogurt, a glass of store-bought orange juice, and a sweet, creamy coffee. It looks like a completely normal breakfast, just like the ones they've had for years. But just a little while later, their eyelids start getting heavy, brain fog rolls in, and their body just wants to hit the couch or lie down. They aren't in pain, and there are no other obvious symptoms, they just feel unusually wiped out and sleepy. Teach. After a meal, your body digests carbohydrates and sugars into glucose. This glucose enters your bloodstream and is used for energy. Insulin is the hormone that acts like a key, helping move that glucose from the blood into your cells. In some older adults, cells can become less responsive to insulin resistance, especially if they lead a sedentary lifestyle, have poor sleep, carry extra belly fat, or regularly eat refined carbs. When this happens, for some people, glucose can hang around in the bloodstream for a lot longer after eating. Because of this, you might feel fatigued, sleepy, or less alert. This sugar crash can become much more noticeable after eating meals loaded with simple carbs or sweets like pastries, instant ramen, soda, or heavily sweetened coffee drinks. While this isn't a definitive sign to diagnose yourself with a condition, it's definitely something you should keep an eye on. Risk. It's important not to jump to the conclusion that every post-meal slump means prediabetes. A lot of other factors can cause fatigue, like not getting enough sleep, eating a really heavy meal, taking certain medications, lack of physical activity, or just plain stress. However, if you're constantly fighting the urge to nap after eating, especially after meals heavy in white bread, pasta, boxed mac and cheese, soda, or bottled juice, you need to pay closer attention. You can start by keeping a simple food and symptom log for 1 week or 2. Write down exactly what you ate, how long it took for the fatigue to hit, how long that sleepiness lasted, and whether it was accompanied by quick hunger, intense thirst, or blurry vision. If this pattern repeats frequently, don't just chalk it up to getting older. Bring these notes to your next doctor's appointment and ask your physician if you should get a fasting blood sugar test or an A1C test. But post-meal fatigue is really only one half the story. Some people don't just get sleepy after eating. They also get hungry again super fast, almost as if their body never actually got the fuel it needed in the first place. Quick hunger and sugar cravings. But here's something a lot of people overlook. Getting hungry right after a meal isn't always about small portion sizes or a lack of willpower. If you've just had a full meal, but a mere 1 hour or 2 later you're already craving cookies, candy, soda, or other junk food, your body might be struggling to process sugar properly after you eat. This is especially notable if it happens frequently after meals heavy in refined carbs. When these quick hunger pangs become an everyday thing, you need to treat it as a sign worth monitoring. You finish lunch and feel totally stuffed. But about 2 hours later, you find yourself digging through the pantry for some cookies, a piece of chocolate, a soda, or even just one slice of bread. A lot of folks beat themselves up for snacking too much or having a sweet tooth, but sometimes this rapid return of hunger actually has everything to do with how your body is handling blood sugar. When you eat, the carbs and sugars in your meal are broken down into glucose. Glucose enters your bloodstream to provide energy for your body. Insulin is the key that helps move glucose from your blood into your cells. But for some people, especially older adults, those cells can become less responsive to insulin. When that happens, the glucose isn't being used efficiently like it used to be, and it can stay in the bloodstream longer. At the same time, if your meal was lacking in fiber and protein, that feeling of being full just isn't going to last. Because of this, some people can get hungry again super fast or get intense sugar cravings shortly after eating. This is usually much more noticeable if your previous meal was loaded with refined carbs like bagels, white bread sandwiches, or sugary drinks like sweet tea and flavored coffee drinks, but fell short on fiber and protein. Again, this isn't a medical diagnosis, but it is a major clue you should keep an eye on. Start paying attention to 3 things. How soon the hunger hits, what exactly you are craving, and whether your previous meal had enough protein, veggies, beans, nuts, or fiber. Jot this down for a few days to get a clear picture of your habits. And when your blood sugar is on a roller coaster, it doesn't just mess with your appetite. For some people, it can actually change how their eyes focus and see things throughout the day. Intermittent blurry vision. There's one sign that a lot of people easily overlook simply because it doesn't happen all the time. In the morning, your vision might be perfectly clear, but after a meal or later in the day, the text on your phone, prescription bottle labels, or price tags at the store suddenly gets blurry. If this keeps happening, you need to pay attention. Imagine someone in their 60s going to the grocery store. In the morning at home, they could read their phone just fine. But when they pick up a bottle of salad dressing or pasta sauce to read the nutrition label, the text is a bit fuzzy. They have to hold it at arm's length and pull it back in just to bring it into focus. They figure their glasses prescription is just getting weak or the supermarket lighting is bad. But a few hours later, their vision is back to normal. When your blood sugar fluctuates, the fluid levels in your body change right along with it. Your eyes are incredibly sensitive to this. For some people, high blood sugar can cause the lens inside the eye to swell or change shape slightly, making it hard for the eye to focus. That's exactly why your vision might get blurry for a while and then clear up again. However, blurry vision isn't only tied to blood sugar. It can also be caused by dry eyes, cataracts, an outdated glasses prescription, blood pressure changes, medication side effects, or other eye conditions. Because of this, you shouldn't jump to the conclusion that you have prediabetes just because your vision gets blurry. The most important thing is to see if this is a recurring pattern and to note exactly when it happens. If this blurry vision comes along with that post-meal fatigue, intense thirst, frequent urination, quick hunger, sugar cravings, or an expanding waistline, you need to monitor it much more closely. While these signs aren't enough to definitively diagnose yourself, they are absolutely valid reasons to get a health checkup. If blurry vision happens frequently or starts messing with your ability to read or drive, have a chat with your doctor. Be sure to describe exactly when it happens, like right after meals or towards the end of the day. If you're over 60 or have risk factors like a family history of diabetes, high blood pressure, or being overweight, ask your doctor about getting a fasting blood sugar or A1C test. And a quick warning, if you experience severe symptoms like intense eye pain, double vision, weakness on one side of your body, or severe dizziness, go to the ER or call 911 immediately. But there is another sign that is even easier to brush off, and it usually happens at night. Frequent nighttime urination. Another sign often creeps up on you in the middle of the night. You've been asleep for a few hours, and then right around 2:00 a.m., you have to get up to use the bathroom. At first, it only happens every once in a while. But after a few months, you find yourself getting up 2, maybe even 3 times a night. You probably brush it off, thinking you just drank too much water before bed, you're getting older, or maybe you just have an overactive bladder. But if waking up to pee comes with a dry mouth, increased thirst, waking up exhausted, or feeling groggy during the day, it's a sign you need to watch more closely. When your blood sugar gets high enough, your body tries to flush out that excess glucose through your urine. Because of this, some people might urinate more frequently and feel much thirstier. That's exactly why midnight bathroom trips sometimes go hand in hand with waking up with a dry mouth or feeling the need to chug water. However, waking up to pee isn't only related to blood sugar. For older adults, this can also be caused by simply drinking a lot of fluids in the evening, taking diuretic medications, water pills, drinking coffee or alcohol, having a sleep disorder, general urinary tract issues, or an enlarged prostate in men. That's why it's so important to look at the big picture. Is this nighttime urination a repeating pattern? Are you unusually thirsty? And are you dragging through the next day? If you just chalk up these midnight bathroom runs to getting older, you might miss a crucial window for early detection. There is no need to panic, but you absolutely shouldn't brush it off if this pattern keeps repeating and comes with extreme thirst, dry mouth, daytime fatigue, or any of those other high blood sugar signs we've talked about. For the next 7 days, try keeping track of a few simple things. Jot down what time you had your last drink of the day, whether you had coffee, a beer, a glass of wine, or a cocktail in the late afternoon or evening. How many times you woke up to use the restroom, if you felt unusually thirsty, and how tired you felt the next morning. These notes will really help you get a clear picture of your habits. If the nighttime urination keeps up, bring this log to your next doctor's appointment so they can figure out the root cause. And while the night might be giving you one sign to watch out for, the daytime brings another change that's even easier to spot, a slowly expanding waistline. This is something a lot of people overlook because they are only paying attention to their overall weight. That's exactly why we need to talk about your waistline next, because when it comes to the risk of prediabetes, the number on the scale rarely tells the whole story. An expanding waistline. Now, let's do a quick self-check. If your waistline is the only thing increasing, we can't jump to any conclusions. But if an expanding waistline is teaming up with post-meal fatigue, quick hunger, sugar cravings, intermittent blurry vision, or frequent nighttime bathroom trips, you need to treat this as a cluster of symptoms worth monitoring. Keep a log for a few weeks and use that information to have a productive chat with your doctor when needed. Gaining belly fat, often called visceral fat, is closely linked to insulin resistance in many older adults. Insulin resistance means your body is still producing insulin, but your cells just aren't responding to it as well as they should. When that happens, it's harder for glucose to get into your cells, which can cause your blood sugar to be higher than normal, whether you've just eaten or are fasting. Now, this doesn't mean that anyone with a larger waistline automatically has prediabetes. However, if your waist size is creeping up over time, especially if you lead a sedentary lifestyle, aren't sleeping well, regularly eat highly refined carbs, drink sugary beverages, or have a family history of diabetes, you definitely need to pay closer attention. Your waist circumference is actually a really helpful piece of the puzzle for assessing your overall metabolic risk. An expanding waistline is absolutely not a reason to beat yourself up or feel guilty. Think of it simply as a health signal from your body that needs monitoring. When you catch it early, you give yourself the perfect opportunity to tweak your diet, get more active, improve your sleep, and get your blood sugar checked at the exact right time. You can start by taking a few simple steps. Measure your waist every 2 to 4 weeks, right around the same time of day. Keep track of which meals leave you feeling wiped out or hungry too quickly. If your health allows for it, try taking a light, 10-minute walk after you eat. Cut back on sugary drinks, and try loading your plate with more veggies, beans, whole grains, and a good source of lean protein. If you are over 60 and noticing your waistline expanding alongside that post-meal fatigue, quick hunger, intermittent blurry vision, or frequent nighttime urination, it's time to have a talk with your doctor. This is especially crucial if you have a family history of diabetes, high blood pressure, high cholesterol, are overweight, or lead a mostly sedentary lifestyle. You can ask your physician if it makes sense to run a fasting blood sugar test, an A1C test, or check a full metabolic panel. You should never try to diagnose yourself based purely on how you feel, but you also shouldn't ignore it when multiple signs keep repeating. This content is for informational purposes only and does not replace professional medical diagnosis or treatment. When you put all these clues side by side, it becomes much easier to see if your body is asking for a little extra monitoring. Let's quickly recap the 5 main warning signs we covered in today's video. Number 1. Post-meal fatigue and sleepiness. 2. Getting hungry quickly and craving sweets. 3. Intermittent blurry vision. 4. Frequent trips to the bathroom at night. And 5. A slowly expanding waistline. If you're only experiencing one of these, you really can't jump to any conclusions. But if you're noticing several of these signs showing up together and sticking around for a few weeks, especially if you're over 60, it's time to take them much more seriously. Having these symptoms doesn't mean your body is turning against you. Think of them simply as data. They are just your body's way of letting you know that your blood sugar, sleep habits, diet, physical activity, and weight might need a little extra TLC tender, loving care, right now. Please don't beat yourself up for feeling more exhausted, getting hungry faster, or going up a pant size. The most important thing is that you're recognizing it early and taking the right steps forward. If you found yourself nodding along to a lot of the signs in this video, start keeping a log for the next couple of weeks. Track your meals, your energy crashes, your hunger cues, those midnight bathroom runs, vision changes, and your waist measurements. Then, take all that information straight to your next doctor's appointment and ask if it's time to check your fasting blood sugar, your A1C, or run a full metabolic panel. Quick reminder, this content is for informational purposes only and does not replace professional medical diagnosis or treatment. If you found this video helpful, please hit that share button and send it to a loved one who might need to hear this, especially your parents, your spouse, or any friends in their 60s and beyond. In our next video, we're going to dive into some simple morning habits that can help you support and manage your blood sugar much more safely throughout the day, so stay tuned for that. Medical disclaimer. This video is intended for informational and educational purposes only. The content is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or a qualified healthcare provider before making any changes to your diet, lifestyle, or treatment plan.